Welcome to another episode of Ignite Health, brought to you in partnership with Caribbean Surgery Incorporated. This program is dedicated to empowering you, our wonderful audience, with trusted medical information, expert insight, and practical advice to help you take control of your health. I am Dr. Surendra Prasad, the Medical Director at Caribbean Surgery, and your host. Each week, we aim to bring you topics that are important to you, important health topics, answer some of the more common questions you will have, and help you understand the whens and the whys. It's time to seek medical care. Because informed choices by you today can help you lead healthier lives tomorrow. Today, our topic is gastric cancer. Gastric cancer, also known as stomach cancer. Now, if we pause for a minute and go back to primary school, was where we learned where is our stomach and what is the purpose of the stomach. So we eat food or we have something to drink. It goes into our mouth. We chew the food. It goes down the esophagus, which is essentially a pipe, and then it goes into the stomach. What's the primary purpose of the stomach? The primary purpose of the stomach is to churn that food, to crush it up and make it smaller particles that can then go into the little intestine when we can then digest it. Going back to our primary school days, we will always remember when we first learned about the stomach. And the stomach is one of those very important organs in our body. So the stomach is part of our digestive system. So when we consume foods or we consume beverages, it goes into our mouth, goes down into the esophagus and into the stomach. And the primary purpose of the stomach is to churn the food we eat and reduce it to smaller and smaller particles. So when it enters the little intestine, we can absorb it. So today we will be discussing the cancers that can affect the stomach, and in medicine or in healthcare we call that gastric cancer. So what is gastric cancer and why are we talking about it today? Unfortunately, gastric cancer, known as stomach cancer, is common. It's a disease where abnormal cells that are on the inside lining of the stomach can become cancerous. And we're talking about it today because early symptoms are often very mild and we ignore it. And early detection can save your life. Now, why is it we ignore these symptoms? So if you think about the symptoms that we all experience almost on a daily basis, stomach pain, feeling full, a little bit of heartburn, those are very, very common. And we will attribute it to other things rather than thinking about stomach cancer. So let's come back to how common is gastric cancer. Now, gastric cancer is one of the leading causes of cancer-related deaths around the world. And in our developing areas and in Guyana and the Caribbean, it's a significant cause of cancer-related deaths. Now, remember, this is a cancer that is affecting the lining of the stomach, the inside of the stomach. So it then suggests, and it has been proven, that our diet is a contributing factor. So we will talk about what are the common foods that cause this, what are the infections, and why, because the symptoms are similar to others, we will tend to ignore it. So one of the first things we will need to talk about is stomach cancer the same as when we talk about acid reflux or stomach ulcers or peptic ulcers? The answer is no. Absolutely not. Stomach cancer is a completely different condition than acid reflux or stomach ulcers. Acid reflux is very, very common. We eat foods and we get a bitterness in our sort of, we call it heartburn. We get a bitterness in the mouth and we get a persistent pain, and that's suggesting ulcers. So many times, and this is what contributes to the delay in the diagnosis, we have these symptoms and we think, oh, maybe it's acid reflux, maybe it's an ulcer. And we go into the pharmacy, we buy things over the counter, and we continue to try to treat ourselves rather than seeking the advice of a doctor. So, however, long-standing stomach problems can sometimes increase the risk of stomach cancers, and we will discuss that. So, who is at risk for stomach cancers? Okay, so as we all get older, we're at risk for many conditions. So adults over 50. Tobacco, as I've mentioned multiple times on this show, there is no appropriate dose of tobacco. So if you're smoking, the first thing you need to do is work on quitting smoking. And it takes multiple attempts to quitting smoking before you will succeed. So the first thing I ask everyone to do is quit tobacco. So again, if you're over the age of 50, if you're a smoker, people with a family history of stomach cancer. Now, that does not mean that if you don't have a family history of stomach cancer, you're not at risk. But if you have a family history of stomach cancer, you need to speak to your doctor early and understand what are your options. People who eat smoked foods, salted foods, preserved foods. Again, the chemicals in these foods are now coming in contact with the lining of the stomach and therefore increasing our risk. All of us in Guyana and most of us in the Caribbean are very, very familiar with H. pylori. What does the H stand for? It stands for helicobacteria. So all of us will at some point in our life become infected with H. pylori. It's a bacteria. It lives in the stomach. One of the challenges with this bacteria is it causes the thinning of the lining of the stomach, and a persistent and permanent infection with H. pylori is now considered today a risk factor, an independent risk factor for stomach cancer. So the simple question is, do diets play a role? Do diets increase our risk for stomach cancer? The answer is yes. So diets that are high in smoked meats, salted fish, pickled foods increase our risk. Now here is the beauty about this. What foods can lower our risk? And in Guyana, we have no excuse for this. Fresh fruits and vegetables help protect the lining of the stomach. So please, all of these fresh fruits, all of these vegetables that we so well produce in Guyana, please, I encourage you to enjoy those and eat them for your general health. And it's not only in stomach cancer, but vegetables and fruits are very helpful for almost all aspects of our health. Now, what are some of the early warning signs? And let me tell you again, when I read this list, I'm not trying to scare you, but what I'm trying to explain to you is that all of us will experience many of these symptoms regularly. And this is one of the challenges with stomach cancer, is that many times these symptoms are associated with other non-cancerous conditions of the stomach, so we may not give it the attention it needs. But here is the list. Persistent indigestion, persistent heartburn. So every time you eat, every time you drink something, you're feeling a sort of a burn, an ache in the stomach area. You start eating and all of a sudden you get full quicker. The stomach has the ability to distend. And so sometimes when you have something developing in the stomach, it doesn't distend, or it occupies a physical space. And so you're getting full faster than you're accustomed to. A sort of mild stomach discomfort. Now everybody will say, well, what exactly does that mean? But you should not be feeling uncomfortable when you have had food to eat. Nausea, sense of feeling bloated. So as I've mentioned, very common symptoms, often ignored, but I would encourage you, if you're having these symptoms, please seek the advice of your physician. Now, what are some of the symptoms that should never be ignored and are suggestive of a more advanced disease? If you are losing weight without trying, and again, let me repeat that. If you are losing weight without trying, you should become very, very concerned and you should seek the advice of your doctor. Vomiting. If you vomit and it has blood in it, that is a cause for concern and you must see your doctor. Dark stools. Now, we are a health talk, and so it is very important to pay attention to what we put into our body and what comes out of our body. And whilst this might sound funny, when you go to the bathroom to urinate, you should be looking at the quality of your urine. When you go to the bathroom and you have a bowel movement, you should be looking at that stool. Now, stool should not look black. And the reason we get concerned about black stool is when you lose blood in the digestive tract, depending on where you're losing the blood, but especially if you're losing blood in what we call the upper intestinal tract. By the time that the blood, which is red when it first releases. By the time it passes through the intestine, it is going to change color and become very black. So if you notice that your stools are darker than usual, please bring that information to the attention of your doctor. Severe fatigue. Why? Because you could be anemic. You're losing blood. So if you check your blood count and you have a low blood count, your doctor will immediately become concerned that there is something causing you to lose blood and they need to figure that out. So if your blood count is low, you get tired very easily, so you become fatigued. A persistent general abdominal pain. That's not just, with food, you're feeling a discomfort, but in general, you're always having some degree of abdominal discomfort. So to summarize again, if you're losing weight and you're not planning on doing that, you need to see your doctor. If you vomit blood, you need to see your doctor. If you have black stools, you need to see a doctor. If you have fatigue or a persistent abdominal pain, please find your doctor, because these are very concerning. As with all cancers, early detection is important. And regrettably, in Guyana and in most of the Caribbean, we are diagnosing stomach cancers too late. And we will get into a little discussion on how we can really get ahead of this, because the ways in which we investigate this are not very, very difficult. Okay? Now, what causes stomach cancer? So anytime we discuss a cancer, people are going to want to know what is the cause and effect. Okay? Now, as we spoke about tobacco, right? Tobacco, alcohol, those are things we want you to avoid. Tobacco, there is no appropriate dose, so you need to quit tobacco. Alcohol, speak to your physician, but we would obviously want everybody to moderate their alcohol, and I'm sure everybody in the audience is smiling when I say that. But essentially, alcohol is a legal drug. We're all allowed to consume alcohol, but it is very, very important to speak to your doctor and understand how much you should be consuming. Ideally, you shouldn't. Okay? Now, as we mentioned before, we were speaking about Helicobacter pylori, or H. pylori, which is a bacteria that's in the stomach. It's worldwide. And it causes chronic inflammation of the stomach lining. And this is now considered an independent risk factor. There are multiple tests that you can have to determine whether you have H. pylori. H. pylori is also the primary contributor to most stomach ulcers and most ulcers of the duodenum, which is the first part of the little intestine just after the stomach. So H. pylori is the most significant contributor to those two. But now we recognize H. pylori as can cause a chronic inflammation, which can then lead to stomach cancers. How is H. pylori treated? So like I said, the blood tests, biopsies, we can determine it. And there are a battery of antibiotics which your doctor will recommend that will treat you for the H. pylori. However, please keep in mind that many times we treat people and they will become recolonized. Now, there's a little bit of a difference between colonized and an infection. So many of us will have bacteria. All of us, for example, have lots of bacteria on our skin, lots of our bacteria in our entire intestinal tract. But that does not necessarily mean you have an active infection. Okay? But H. pylori, treated with antibiotics, and your doctor will then review your symptoms and see how well you are improving. Now, how do we diagnose it? And again, many, many times, this is diagnosed too late. Right? As with any cancer affecting an organ, if you think about it, the organ has a certain thickness. So if you think about it, the stomach has a wall. It has an inside, it has a thickness of the wall, and it has an outside. And we generally, for most cancers, we talk about the stage of a cancer. So if the cancer starts on the inside and it hasn't gone deep into the wall, we say that's an early stage or a stage 1. And then if it is inside, it has spread into the wall, well, that's a stage 2. If it has gone to the outer edge, stage 3. If it's gone to other organs, stage 4. We don't want to find it at those latter stages. We want to find it when it is now starting in the stomach. So you have these symptoms, and we will have a big discussion on the upper endoscopy and what does that mean. But many times, because of the symptoms we discussed before, your doctor is going to recommend that you have an endoscopy. What is an endoscopy? Now, the good news is most of the time you're asleep when we do this procedure. You fast overnight, you come in the morning. The tube is about the size of your little finger, but quite a bit long because it's got to get all the way into the stomach. We lie you down, anesthesia will give you something to make you a little bit sleepy. We numb up the throat sometimes, and we pass this tube it's a fiber optic tube that has a camera and a light. So as the tube is going down the mouth into the esophagus, into the stomach, and into the little intestine, and the tube is flexible. So we are looking at a TV and we are getting the images out of the stomach. And this is what an upper endoscopy takes, about 15 minutes. And through this same tube, it has little channels that we can pass tiny wires which have little biopsy instruments. So we call them forceps, but it takes essentially a pinch. And they also have loops. So we can remove anything suspicious. We can take a biopsy. Sometimes if it's small enough, we can remove it in its entirety. So many times that is how an upper endoscopy is done, to screen, but sadly, many times it is used to diagnose. So the biopsies are taken, they're sent to the pathology lab, they look at it under a microscope, and in about a week or two, your doctor will get back an answer. And this will say whether the cells have become cancerous, at risk of becoming cancerous, or not cancerous. And that will then make the decision about what happens next. Now, many persons will say, well, I'm not sure. When should I have the endoscopy? Should I not have the endoscopy? My simple answer to this is, everything in life is a risk versus a benefit. What is the risk of the procedure? So an upper endoscopy, yes, you are sedated. It's not a general anesthetic, you are sedated. So you need to speak to your doctor about, are there any medical conditions you have that are too risky for you to have an endoscopy? The vast majority of persons will not be at high risk. But this procedure, like I said, takes 15 minutes, done as an outpatient procedure. You come in the morning, have the procedure done. 4 hours later, you could be going home. So who should get tested? Even if you're not having symptoms. If you're having any of the symptoms we spoke about, you need to see a doctor and consider an endoscopy. But if you're not having this, who are those persons who should still consider this endoscopy? Persons with a family history, persons who have had a persistent H. pylori infection, adults again with any kind of digestive issues. So when we screen patients for conditions, you will notice that adults over the age of 50 pops up in multiple screening programs. So all adults over the age of 50 should have an endoscopy. All the adults with family history should have that endoscopy possibly 10 years earlier than their family member was first diagnosed. H. pylori infections, you should have the endoscopy done so your doctor can determine what is it stomach ulcer, is it reflux, is it stomach cancer. Is gastric cancer treatable? The answer is yes, and especially if it is caught early. However, our ability to cure you of it varies significantly depending on whether it's an early stage or a late stage. Cancers of the stomach, it's what we call multimodal. It's a combination of surgery, chemotherapy. Chemotherapy is where we administer a drug that will pretty much travel your entire body and find those cancer cells and aim to kill them. The challenge with chemotherapy is most chemotherapy cannot distinguish easily between a cancer cell and another cell that is growing rapidly, and that is one of the side effects. We are getting better every day with research at developing therapies. So you will hear immune therapy and all this. So research is ongoing, and we are now beginning to target the treatment for cancers better. Radiation therapy is the other option, and this is where a beam of radiation, so all of us have had chest x-rays, and so we use something similar to that to deliver radiation to a specific area of the body. What about survival? What happens if you have gastric cancer? Again, as is true for almost all cancers, if we find it early, your survival rates are good. Unfortunately, in the vast majority of cases, we find stomach cancers too late. And at that stage, there is very little we can do to save that person. Our therapies will generally prolong life, but we are unlikely to be able to save somebody or cure somebody with a later stage stomach cancer. Okay? So, can it be prevented? So, we've talked about diagnosis, we've talked who's at risk, we're talked about whether it's treatable. Can it be prevented? So, we talked about the fact about diet, and we talked about tobacco. So, step one, quit tobacco. Step two, see your doctor. Step three, look at what you are eating. I am not going to ask anybody to give up on any food they love, but I will ask you to reduce it. So especially the smoked foods, the salted foods, the pickled foods, reduce those. What do I want you to eat plenty of? I want you to eat fruits every day. I want you to eat vegetables every day. And if you have H. pylori, speak to your doctor about getting rid of that. So again, quit the tobacco, reduce the smoked foods, reduce the salted foods, eat lots more fruits and vegetables, treat the infections. Our role here is not to scare you. We don't want to make you afraid. I don't want people at the end of this program to be panicking. As we said at the onset of this program, our idea and our plan is to inform you. Knowledge is power. Don't be scared. Speak to your doctor. Today, we all have access to a tremendous amount of information. Go on the internet, go on the clouds, go where you have to go, get the information, come to your doctor, and get clarifications. So, on a final note, what is the one thing I want you to remember? Step one, quit tobacco. Step two, if you're having any symptoms that are persisting or you're not sure about that are related to the stomach, please seek the guidance of your physician. An upper endoscopy widely done in Guyana in both the public health system and in the private sector. So there's really no challenge in terms of access. And so you can get this procedure. Like I've said, it takes about 15 minutes. All you have to do is fast overnight. You're asleep when the procedure is done. And 4 hours later, you're home. So on that note, thank you very much for joining us. And we look forward to seeing you on another episode of Ignite Health with Caribbean Surgery.